everyone. This is Resham from IHW TV. Welcome to a very, new live, a live related to health and wellness. For those of you who are joining right now, let me tell you that our channel is actually all about giving you information and basic news related to health and wellness. And I'm sure that you have read the title and are aware that today's topic is dedicated to cardiac arrest and pregnant women. Yes, so we know for a fact that the cases of cardiac arrest and the deaths leading to the deaths caused by cardiac arrest is increasing at a very high and faster pace, and that has actually become the cause of concern too. Where for those of you who are into news and are aware to what's going on around the world, let me tell you that a recent case of a young individual dying of cardiac arrest has shocked everyone. And this particular case is actually more shocking and surprising because the death caused by cardiac arrest was actually happened to a pregnant woman. I'm talking about Dr. Priya, who was also Malayalam TV actress, and she was just 35 years old, who lost her life because of cardiac arrest. She was 8 months pregnant. The doctors tried their level best to, you know, save the actress, the Malayalam actress, but unfortunately they couldn't. But yes, they actually were able to save the 8-month-old child. But unfortunately, like I said, Dr. Priya could not be saved. So today's topic is actually dedicated to heart health and how pregnant women, especially, can take care of their heart. So that is what we are going to discuss in today's live as well. So we know for a fact that, and especially traditionally, female hormones were actually believed to protect the heart. But now younger women are actually found to be exposed to certain stressors that make them just as vulnerable. And, we know, especially after the pandemic, there is something we are seeing, which is cardiac arrest amongst the young population too. The reason is not being found, but it can be a lot of things, be it, of course, your body has become more weakened because of the, of course, because of the pandemic. Your body cannot take the extra pressure, and of course the climate change, the your lifestyle things, the your lifestyle changes are of course some of the factors and criteria that are leading to the sudden cardiac arrest, as some of the doctors are saying. But there are a lot of things that pregnant women can follow, especially so that they can protect their heart and, of course, take care of their heart health as well. Firstly, the first suggestion, the first thing that experts recommend is to always keep a track of your heart health. It's not just the males or the people who are over 40 should go for constant checkups, but even now, because now we are aware to what's going in and around the world, so it's important for younger population and pregnant women as well to keep a note of their heart health as well, and go for constant checkups as well, especially during first trimester. It's very, very important. Then secondly, it's important to keep a note of your blood pressure as well. For those of you who don't know, the normal pressure is 120 to 80, and if it goes above that, and of course, if the margin is quite high, then you have to consult your gynecologist plus your normal physician as well. And I think that person, the doctor, can of course guide you to what next you have to do. Then other than that, like I said, going for a regular heart checkup, managing your blood pressure are the two things that the pregnant woman can do. Other than that, it's important to manage your diet. It may seem very simple and basic, but let me tell you, your diet also plays a major role in building a healthy and fit body. So it's important to include all the greens in your vegetable. Let me tell you that a rule that all the pregnant women should follow is include as much colorful food in their diet, that is include a lot of red vegetables, green vegetables, yellow, and of course, a variety of all the colors, so that they can receive the desired nutrients that is of course essential for their health and the baby's health as well. Then when you're managing your weight, your diet, with that comes managing your weight as well. Of course, with pregnancy you are tend to put on a little weight, but keeping a track on that as well is important. You can go for light exercising, like light cardio, like brisk walking, normal walking, just yoga, a little bit of aerobics, you can go for that. And even for yoga, you don't have to go for the power yoga, and you're just going, shedding a lot of sweat. No, you don't have to do that. Go for normal yoga, like I said, brisk walking, and you are good to go. But exercising during pregnancy, if you think it's not right and you should not go for it, and if you're lifting heavy weights, no, I'm not asking you to do that. But going for normal exercising is very important for you and your baby's health as well, and that actually helps in managing your weight as well. Of course, let me repeat, you are tend to put on a little weight, when a lot of weight for some when you're pregnant, but that's all right. But then having, or a lot of junk and putting on a lot of weight is of course something that you should not go for. And of course, keep a note and track on that is very very important. Then now we talked about a diet, not putting a lot of excess weight. Then it is important to get your enough sleep as well. This is also very basic, and we think this we can do, but let me tell you, these basic things are something that are ignored the most. So getting a 8 hour sleep, especially for the pregnant ladies and for your heart health, is very 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 essential. So of course, and before you're sleeping, make sure that before sleeping you are giving a 1 hour break to that screen. That is, you're not using your mobile phone or any other type of screen before sleeping. At least give a 1 hour break, keep your phone aside. You can meditate, you can read a book, or you can talk to your loved ones. But then after that, give a 1 hour gap, and after that make sure that you go for a deep sleep, and of course go for an 8 hour sleep, which is actually a key. You may think that it's very basic, but that can actually bring about a major difference in your lifestyle and your overall health as well. Like I said earlier, it's very very important to monitor your blood pressure as well, because that actually depicts and is one of the major criteria for a good heart as well. Other than that, there is something that has been noted, is that pregnant women, because of the hormones, the rushing hormones, they tend to stress a lot. You actually need to manage that and keep control on your emotions and of course your stress level. Working is quite basic. Going to your office, going to your workplace, even when you're pregnant, is quite normal and something that you should not ignore or not go for. But then going for proper meditation and going for normal exercising and not stressing about small things is very very important, and that is one point that you should all consider for a better heart, for a better health, the overall health. And like I mentioned earlier, paying emphasis on your diet is also very important, including a lot of reds, including a lot of colorful things in your diet, going for veggies. And according to experts, the women who are pregnant should take at least 2500 calories in a day, and that is actually the apt amount of calories, the calorie intake. Other than that, like I said, include more of dairy, not too much, because now recent studies are coming up that including dairy in your diet is not good. But then again, eliminating something completely from your routine is of course not the solution. So having everything in moderation, be it dairy, be it protein, be it good fats, is of course very important. So you should not eliminate dairy from your diet. include it, but then of course make sure that you are taking it in moderation. And then lastly, meditating and exercise, like I mentioned earlier, are some of the ways by which you can have a healthy self, a healthy body, and of course take care of your baby's health as well. So in the end, it's important to get yourself a routine checkup. So just don't think that you're young and you're just young, so you're pregnant and your hormones will be in your favor. No, that is not the key. I think the recent case of Dr. Priya, the actress, actually cleared a lot of things. So it's important to take care of your heart health during pregnancy as well, and that is actually very, very important. Remember that. So that was all for today's like. If you like today's segment, then do not forget to like, share, and subscribe to our channel, and do not forget to share this video as much as you can. Thank you so much for joining.